We are not sure why there's such a commingling of SCAD with FMD, or why FMD is so prevalent. We actually don't know the prevalence of FMD in the average healthy young female population. I don't think we've scanned abundant numbers of women to know for sure how prevalent it is. There are some estimates, but it's likely that it is more common in patients who've had SCAD, and we think that's probably that there's some underlying systemic blood vessel fragility that's associated with having FMD. We know that when we see FMD, often we'll see the beating, the characteristic beating, but quite frequently we'll also see focal dissections involving blood vessels in the vertebrals, the carotids, or even the renal arteries that were completely asymptomatic. So it does seem like there is some sort of systemic process that's ongoing. One of the things that we've seen both in men and women, but most commonly in women, is a history of stress and anxiety in our SCAD patients. In fact, a history of migraine headaches, anxiety is very common in our average SCAD patient. So I just want to raise awareness about the importance of treating psychological and stress conditions in young women. I think women today have many responsibilities, and we're living in a very fast pace, and so it's not surprising that women are experiencing higher levels of stress than they were in the past. And we know that stress particularly contributes to SCAD, but also to other forms of heart attack, such as broken heart syndrome. So I think it's important for healthy young women to manage their stress better and not to be afraid to ask for help, whether it's through counseling or medication, or figuring out adaptive ways of managing stress in their lives. It's certainly kind of reaching a point of it's a very critical problem now in our society, and we need to address it better. Men are more likely to have SCAD onset during aggressive or excessive physical exercise, and that can include recreational physical exercise such as weightlifting, running, competing in a sport where they're really trying to win at a very high level, or something as simple as carrying a heavy load, or heavy bags, heavy boxes, but it typically will involve straining of some sort. So that's much more common in men. From an anatomic perspective, the type of SCAD, in men we see that it's more common to have type 1 SCAD, which is where you have a tear in the wall of the vessel, of the blood vessel, versus type 2 SCAD, which is where you have the swelling in the wall of the blood vessel, and that leads to a much more smooth, sort of extensive but very smooth disease of the artery, as opposed to just a sudden abrupt closure of the blood vessel.